The most common problem leading to carpal tunnel syndrome is mechanical pressure from actually sleeping positions and also activities during the day. See, at night, most of us sleep with our wrists flexed like this, which puts pressure on the tunnel. You might go to sleep with your wrist straight, and you might wake up with your wrist straight, but chances are in the middle of the night, the human reflex is to sleep like this. And that's going to put pressure on the tunnel over here. And this is why people with carpal tunnel syndrome often wake up and they end up having to shake their hands out to make them feel better in the morning. Now, activities during the day that require repetitive hand use, such as typing or carpentry, are risk factors as well. This is actually for two reasons. The reasons that most people think about with this is the position of your wrist during the activity. If there's wrist flexion, for example, when you're typing, this can compress and irritate the tunnel, right? Because it's like this. But also passing through the tunnel are 9 tendons that flex the different parts of the fingers. And any activity that repetitively uses those flexion tendons, again, like typing or guitar playing or hammering, can lead to swelling around those tendons, which in turn takes up more pressure in the tunnel, and this can then lead to increased pressure on the median nerve. And then finally, anything that narrows the space of the tunnel, like a hereditary smaller tunnel or being in pregnancy, which will lead to just generalized increased fluid and swelling, will also predispose towards carpal tunnel syndrome. Other conditions like diabetes, rheumatoid arthritis, and thyroid issues also predispose people towards carpal tunnel syndrome. Now, in physical exam, putting pressure on the carpal tunnel, either by having the patient flex their wrists, so going like this, or by actually pressing on the carpal tunnel, will often reproduce the symptoms. The most common diagnostic test is electrodiagnostic studies, or what's more commonly called an EMG. This is the best way to confirm a diagnosis and also to understand the extent of the damage to the nerve, which we usually characterize as either mild, moderate, or severe. The EMG will give prognostic information. So mild carpal tunnel syndrome often responds very well to bracing and activity modification. A carpal tunnel brace is one of the most common braces that's used, and the purpose of it is to hold the wrist in a neutral position. In very mild cases, in which there's no obvious underlying reason for the syndrome, using the brace only at night is sometimes enough to treat it. As time goes on, patients often stop using the brace altogether, and then they should just kind of hold on to the brace, they put it in their drawer, and if the symptoms start to come back, they can always put the brace back on. Now, if the symptoms are worse and they aren't getting better with wearing the brace only at night, then wearing the brace all day may be necessary. Always, you're going to want to consider a person's activities of daily living, right? If the patient's using a computer all day, then it's important to look at the computer setup, right? To make sure that the ergonomics are as good as they can be. You want to make sure that their wrist is in neutral position as much as possible, like, for example, at the computer.